Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Monday, March 23rd at 5 p.m. So I hope all of you are staying safe at this critical time in our history. I look outside and I see scatterings of people walking. My husband and I went for a walk today, and there are a fair number of people in my area going for a walk. Of course, they're avoiding you. So if you're crossing each other, somebody's walking off the path. They don't want to get too close. Hello, Cecilia. How are you, honey? Okay, so questions people are asking to me on the news, everywhere you go, in general, is will we find a cure for COVID-19? Understand that antivirals, as I've talked about in the past, viruses are very tricky, okay? The treatment is not as simple or as straightforward, I should say, as antibiotics, which actually kill bacteria. In the case of viruses, usually you're just preventing the reproduction. You're preventing it from being able to infect a cell and reproduce. Okay, so yes, you're sort of killing the virus that way, but you're sort of not. You're sort of just preventing it from replicating, which in essence does the same thing. Okay? But researchers promise a vaccine is coming. Now, I don't want to get into a vaccine discussion if you're pro or con. That is not the point. This is merely to talk about cures or treatment options at this point. They say that it'll likely come, but at best it'll take about 10 to 12 months. Now, as far as vaccine development, understand it usually takes an average of 10 to 15 years to develop a vaccine. A vaccine must go through several phases of development, including research, animal testing, human clinical trials, and quality control. In the case of epidemics, such as this, hello Heidi, the FDA expedites the process. So one possible vaccine is currently in phase 1 trials here in the United States. They have 45 volunteers who have already received one injection. Personally, I say, better you than me. They couldn't pay me enough money to inject me with anything at this point. So as I said, we will be beyond this outbreak by the time this vaccine is available. Now, if COVID-19 is anything like SARS or MERS or any of the other epidemics that we've seen, they come, they go, and they don't come back. Unlike influenza, which comes back every year, these type of novel viruses usually run their course and go away. Hopefully that will be the case, because this one is pretty darn nasty. Hopefully the vaccine will be a moot point. We won't be needing it in the future. Hello, Stephanie. I'm not saying that's the case. Nobody knows. But all the research is being done, not just for creating a vaccine. Other possible treatment options that are being looked into. Number 2 is high-dose vitamin C infusions. Supposedly, the Chinese government is encouraging people to use this. Vitamin C plays a role in reducing inflammatory responses and preventing the common cold. A few studies show vitamin C deficiency is related to an increased risk or severity of viral infections in general. And one study done way back in 1978 showed an increased resistance to infection by a coronavirus, not this one, in chick embryos. But that study is very old, and it's hard to extrapolate that information to today and to this coronavirus. So randomized controlled trials are currently underway evaluating if high-dose IV vitamin C can improve the prognosis of patients with severe acute respiratory infections associated to COVID-19. Again, the information may take a little while. It has not been proven yay or nay. Personally, if I was to pick anything that I would do without appropriate research behind it, that would be my choice, simply because it's a water-soluble vitamin that can accumulate in the body. in my opinion, it can only do good. It can't do harm. Again, that I can't say that blanket statement across the board for everybody, but for me, I'd stick out my arm, let them put an IV and give me some high-dose vitamin C if I was concerned. But number 3, what about existing antiviral medications? Hi, Diane. So they're looking at these. They're looking at antivirals. Now, we've talked about this in the past. When it comes to antivirals, they're usually very specific to the virus that they're treating, which makes it very difficult for them to be used across the board for different viruses. Hi, Glenn. So when they talk about the HIV medications like lopinavir or ritonavir, they're usually used in combination for HIV. One clinical trial provided very underwhelming results, and only 1 out of the 18 patients who started the study actually completed the 14-day treatment course as a result of adverse effects of the treatment. So you can't really have a clinical trial if only 1 person out of 14 is able to complete the process. Clearly, that would not be an effective option. So I'm not saying this is off the table, but this right now is not a viable option. What about influenza medications such as Tamiflu? They were tested in vitro, meaning in a petri dish, basically, and they showed no reduction in cell growth, basically no cytopathic effect on COVID-19. So that one's off the table. So they're using lots of these to try and look and see if there's anything that can help. So there are some emerging treatments showing some promise, including an antiviral that was used for Ebola, an anti-malarial drug, which I'm sure you heard President Trump mention, and we're going to talk about that more tomorrow, and possibly monoclonal antibodies from COVID-19 survivors may be an option. So again, that is not all the options. Those are the ones that I've found so far, and there are options. Anytime you have a drug that, and this was a pet peeve that I had as the media kind of tore into Trump, and this is not a political discussion whether you're for or pro or against him. They ripped into him because they said this drug is not FDA approved. He said the drug is FDA approved, specifically talking about chloroquine. Chloroquine is an FDA approved drug for malaria. It's not FDA approved for this, but as doctors, we know we use drugs off-label, meaning not for the intended use, because the drug is out there, and if it has a safety profile that is pretty safe in general, I'm not saying for all comers, I'm just saying in general, that is a treatment option. That's why they're looking at HIV medications, and that's why they're looking at medications for that, like Tamiflu. They're looking at things that are already here, that have already been FDA approved, and can we shift over the purpose of their use to something to use for this, to slow down the progression of a disease, etc. So we're going to talk about it more tomorrow. So tag a friend, stay tuned, come back tomorrow, share this on your page. I am not by any means an expert. I'm just trying to give you information that I found, trying to make it clear. And yikes, that was a phone call. So trying to make it clear and understandable so that you guys can absorb it a little bit better. If you're a medical person like myself, some of it is easier to understand. I look at some of this paperwork and information and I say, this is crazy. I can't understand any of it. So I'm trying to help you out. Okay, so stay tuned for tomorrow. More information coming. Okay, so please stay safe. I hope you guys are having an awesome day with your family. I'll see you again tomorrow for another Live in 5.